The next thing I'd like to demonstrate for you is a method for providing compression to the patellar tendon for patellar tendonitis. It also works very effectively for fat pad irritations, particularly after ACL reconstructions, and for the general kinds of problems that occur that maybe have a chondromalacia kind of an interference as well, but the important thing is that a lot of the pain is really in the patellar tendon. And this is a ready-made piece of Pro Wrap, which is referred to as PattStrap. And the idea is to put compression, once you find the joint line, you're going to put compression right over the joint line, just distal to the apex of the patella. So you start this, lay it on, go right around the joint line, and then secure it with the fastener. Now, the beauty of this is really that, number one, it stays in place. It doesn't slide up and down easily. You see how the skin moves with it. And it can be adjusted quickly. Like during the course of a run, if it's too loose, you can very, very quickly undo it and pull it just a little more snugly. Or if it's too tight, then of course you can relax it very nicely. But it's easily adjusted. And this provides really an excellent kind of counterforce band for patellar tendonitis and for patellar tendon fat pad irritations. One of the problems we see in runners frequently is an IT band problem at the knee. And basically, if you move right from Gertie's tubercle and go directly up into the IT band, as the knee goes into extension, it very often snaps across the lateral portion of the femur. And if we can find a way to tend to stabilize that a little bit, give enough compression to it to kind of keep it in a better position when it goes into extension, it doesn't give the runner as much irritation. So what we're using is the PattStrap. Again, this is a strip of Pro Wrap pre-cut, and it's about 1.5 to 2 inches above the base of the patella. We're going to put this around and give it a very, very firm tug. Give a lot of compression to the IT band in that level. Then when a knee goes into extension, there's much more compression to force it into better tracking so that we don't have the irritation at this level on the femur.